Bruce Arroll is my name. I'm a professor of general practice and primary healthcare at the University of Auckland. And I also work as a GP in a general practice in South Auckland and Manurewa, where I do acceptance and commitment therapy consultations with patients who are referred to me from my colleagues in the clinic. This talk is Introduction 1A about focused acceptance and commitment therapy, which is acceptance and commitment therapy designed for the primary care setting. This is my version of FACT and not necessarily endorsed by other practitioners of FACT or ACT. So a new psychological approach is required in primary care. One is because of the time constraints. Two, the brief patient or client contacts, fewer follow-up visits needed, need to make the most of each session, trying to get better results in less time. And this work is designed for psychologists, counsellors, GPs, family physicians or nurses. So what are the psychological issues in primary care? Well, some work done from the waiting room in a series of general practices in Wellington in the early 2000s found that 35.7% of patients had a mental disorder at the level of the DSM-4, so all at quite significant levels. So there's lots of pathology in a primary care clinic. Some work we've done, we found patients with a PHQ-9 score of greater than 9, which is mild or more major depression. 12.9% of patients reporting symptoms over the previous 2 weeks. So what are the medical issues? So they're the psychological issues. So there's many medical issues. Control of diabetes, control of hypertension, patients with pain, unremitting pain, patients with fatigue, insomnia, and the large group of medically unexplained symptoms, which is an issue in primary care or in general medicine and surgery. And there's invariably the psychosocial issues that go with all of this. So what's needed? So what we need is a simple model, transdiagnostic, so getting away from specific diagnoses, universal treatment principles, uniform treatment principles, needs to be evidence-based, apply to a broad range of problems and to be done within a 30-minute consultation and then perhaps 1 to 3 follow-up visits from that first one. So what I'm describing is focused on acceptance and commitment therapy, and this has been developed in Washington State in the United States by Dr. Kirk Stroessel and his wife, Patricia Robinson. This is a view from their vineyard in Yakima in Washington State of Mount Adams, one of the volcanoes in Washington State. And this is a picture of Kirk, who's on the left of the picture, and one of the family practice residents. So he works in a clinic in Yakima with 25,000 patients, so it's massive, and there are 4 psychologists who see patients and clients who are referred to them from their GPs. They try and keep clear templates, so they're available for what they call warm handoffs. So that's where they can refer a patient to a psychologist when they're needed. So the psychologists keep their templates clear so that they don't have lots of follow-ups. So 20 or 30 minutes in the first consult, median number of visits is 2, and they start treatment at the first visit. Because if you don't start treatment at the first visit, there's a reasonable likelihood that the patient won't come back. So why FACT, Focused Acceptance and Commitment Therapy? It's simple to learn. There are the 6 tools of ACT, which have been crunched down into 3 tools, open, aware, and engage. It's effective for mental health work, and it's also effective for physical health problems such as diabetes, smoking cessation, pain. And it's transdiagnostic, so patients don't get a label of personality disorder, depressed, anxiety. They get a label of being stuck and inflexible. And interestingly, I find patients actually quite like the term stuck because that describes how they're feeling. And words like depression and anxiety still have a pejorative sort of feeling about them in our society. There's still a little bit of stigma. And if, in terms of writing stuff in the notes from an insurance point of view, stuck is a much more benign term.